Okay, we are going to look at this 45-year-old man who was admitted to the hospital for acute shortness of breath. He does not have a smoking history, but he does have a family history of heart disease. His lungs are clear during auscultation. He becomes breathless just moving around his hospital room. He denies recent history of respiratory infections. Because of his rapid respiratory rate, his attending physician requested an ABG using room air and a VD-VT ratio determination. So here we have our patient demographics. He's 45, he's 67 inches tall, about 175 pounds. Looking at his blood gases, his pH is 7.9, that's a little high, so a little on the alkalotic side. CO2 is at 29, a little low. PO2 is at 102, which he's breathing room air, so that's a little on the high side. Bicarb is 21. Hemoglobin is 14.2 with an SaO2 of 98%. So if we were to interpret this blood gas, we would call it respiratory alkalosis, compensated respiratory alkalosis, because our bicarb is 21 with hyperoxia. Next, we measured his minute ventilation and his exhaled CO2, and his minute ventilation was 24.2 liters per minute. He did 20 breaths per minute during that measurement, and his exhaled CO2 was 14. So let's plug in our numbers and calculate this out. So the first thing we need to do is find our tidal volume. So here I have our minute ventilation results, and we're just going to plug that in. So 24.2 liters per minute, our minute ventilation. Divide that by our respiratory rate of 20, and we end up with 1.21 liters. If you recall from our lung volume lesson a few weeks ago, normal tidal volume is usually more like 500. So this is nearly double a normal tidal volume. So he's not only breathing fast, he's also breathing very deep. Okay, so now we can calculate out our dead space because we have our tidal volume and we have our exhaled CO2. So let's do some math. So our VD-VT ratio calculation is PACO minus PICO divided by PACO. So PaCO2 minus your PeCO2 divided by your PaCO2. So plug in your numbers here. We have 29 minus 14 divided by 29. We end up with 0.517 or 52%. So his VD-VT ratio is 52%. So now let's go on and let's try to find out what our total dead space is. So to do that, we're going to solve for our dead space. So we're just going to rearrange our formula because we now have our VD-VT ratio and we have our tidal volume. So plugging in our numbers, our VD-VT ratio is 0.517. Take that times our tidal volume, which is 1.21 liters, and we find our dead space is 0.626 liters. Okay? That's pretty big. That's a big one. So now let's look at our alveolar ventilation. So if you remember back to our diagrams, okay, we're trying to now find out our alveolar ventilation. We found out what our dead space is, but now we're trying to find our alveolar ventilation. What's really going on in there? So let's take a look at that. So to do that, we're going to take our respiratory rate times our tidal volume minus our dead space. So we'll plug in our numbers. 20 times 1.21 minus our 6.26 liters, and you end up with 11.68. So what does that mean? Okay, we've got all these numbers now. Let's look at what it really means. So our total ventilation was 24.2. Okay, that's our total minute ventilation. That's how much air he's moving in and out of his body, and he's in a minute. In a minute. So of that 24.2, only 11.68 of that is actually being involved in gas exchange. So nearly half of his total minute ventilation is being used for gas exchange. That is ridiculous. That is way low. Healthy subjects have a VD-VT ratio of about 30 to 40% at rest. And then as you exercise, it's going to change, obviously. Any dead space higher than normal could be due to either a pulmonary embolism or a pulmonary hypertension. So those are kind of the big takeaways from this patient's case.